Pain, a word that everyone knows, feels, and wanna never ever have it, touch it, and getting close to it in their entire life. We can define this word in a vast spectrum. It can start from a just simple scratch on our cheek to a severe, acute, intolerable headache, and finally it can reach the point that can kill someone in just few minutes if it remains untreated. So in this video we're gonna be just focusing on abdominal pain and all reasons that can make us feel it. The first and the most important thing in the abdominal pain is to bring out a life-threatening condition and put it under therapeutic plan, emergent therapeutic plan. For example, a 30-year-old boy with infected appendicitis needs emergent intervention than someone with just a simple gastroenteritis, right? Obviously, these both are not equally dangerous, despite the fact both can have same manifestation and have them just feel the sharp pain in the right lower part of their abdomen. There are 6 necessary key components about abdominal pain that we must know to determine if the situation is urgent or not. The first one is age. You probably get more afraid if your 50-year-old uncle feels a sudden pain on his stomach area than your little cute 10-year-old cousin crying for the pain in the same area. Actually, the pain in youngers can be dangerous as well, but not as much as someone like your uncle that makes him visit the nearest hospital urgently. The second item is the time and onset of the pain. Probably we all get more alerted for an acute abdominal pain that has just started 15 minutes ago than a pain that we still feel after we drank a cup of apple cider vinegar with lemon juice last week after dinner. Be careful that every patient with sudden acute abdominal pain needs a thorough evaluation. So never ever ignore the abdominal pain that has just started a few minutes or a few hours ago. The next component of abdominal pain is the characteristic of pain. It means the way someone feels the pain. For example, cramping pain is when we feel like sudden tight squeezing or spasm in abdomen. This type of pain usually happens in bloating, irritable bowel syndrome, menstrual cramps, or indigestion. Or some may describe their pain as heavy sensation in the stomach that is mild and often tolerable. This is called dull pain. This happens often in conditions like gastritis, early stages of appendicitis, and indigestion. This type of pain is usually diffuse and the patient cannot exactly localize the pain. Some people describe the pain as sudden and intense pain in an exact area in their abdomen. If you ask them, they can exactly put their hand on a pain site and they may say, I feel like someone has stabbed me right in this point. And we see this type of pain in some conditions like gallstone, kidney stone, and sometimes advanced stages of appendicitis. Another aspect of the abdominal pain is the duration of the pain. It means how long the pain lasts. Acute pain refers to when a pain has happened in few days, but usually it has happened suddenly. Common diagnosis of acute pain is gastroenteritis or stomach flu, appendicitis, gallstone, kidney stone, and some stages of pancreatitis. But if the patient is struggling with the pain for about weeks, months, or even years, we call this type of pain chronic abdominal pain, okay? And we can see this type of pain in some conditions like mild peptic ulcer disease, indigestion, in some women, menstrual cycle, and early stage of appendicitis. Generally, this type of patients ignore their pain for a long time, and they have adopted as a result of their tolerance, using some home remedies and using over-the-counter medications. And this is what makes them not to visit the physician in the right time. Some of them may misinterpret it and consider their pain as a result of indigestion, stress, and some other reason that they may think is a reason of their pain. That is why the pain lasts too long, and unfortunately a major part of them will face some paralyzing complications. One of the most important components of the stomach pain that is necessary to know always is the exact location of pain and size where the pain radiates to. Into different anatomy classification, we can divide a stomach into 4 different parts or 4 quadrants that you can see here in this picture. Right upper quadrant, right lower quadrant, left upper, and left lower quadrant. And in the other one that is probably better, we divide a stomach into 9 separate regions like what you see in the picture. Right upper, epigastric, left upper, right flank, periumbilical in the center, left flank, right lower, suprapubic, or we call it sometimes hypogastric, and left lower region. Actually, the history we take from the patient about where the pain is located get us valuable clue about the cause of abdominal pain. It scientifically narrows our differential diagnosis and help us limit our management to some just more prominent diagnoses. The simplest way to think about the cause of the abdominal pain based on a pain side is to consider what organs are within that part. Actually, this is not a whole story, as you know. As it's being said, it's just a clue. Because sometimes the radiation pain in another different part of the stomach can be the center of the pain, but the organ beneath that part is completely intact. And that is why we might perform further workups to make sure about a real cause of pain. For example, in some cases of appendicitis, the patient might feel severe pain in the left lower region of the abdomen, despite of the fact we know the exact location, the exact anatomic location of appendix is in the right lower quadrant. Or epigastric pain in some cases indicates myocardial infarction or heart attack. And the final component of abdominal pain is associated symptoms and the relationship with pain. For example, it's really necessary to know if the patient has nausea, vomiting, or just sense of the vomiting, diarrhea, constipation, blood passing through the rectum, and other symptoms that can guide us to the real culprit of the pain. There are more than 120 reasons and disorders that cause abdominal pain. So when a patient complains of tummy pain, you're confronting more than 120 different diagnoses. So it's really important to know the characteristic of all the abdominal pain and know, for example, how does the pain in gastroesophageal reflux disease shows itself, and how to differentiate it from the same pain in the same region which happens in the, for example, pancreatitis. This is the greatest step to approach to the final diagnosis. But be careful that almost all the time you cannot just rely on history, and even sometimes spending more time on taking history or physical examination may be fatal. Because some problem like intra-abdominal hemorrhage in a patient with ruptured aneurysm needs urgent treatment, so you cannot miss the golden time in such cases. After we have swept aside all life-threatening diagnoses, for the final diagnosis we probably need some more investigation, and we might use paraclinic tests like laboratory tests, imaging tests, sometimes cardiac tests, and even pulmonary function tests. As it said before, in one anatomy category, we divide abdomen into 9 different regions. The location of the pain can assist in narrowing the possible causes. Now here we're gonna discuss some of them which are more frequent and those that are more dangerous. Let's start with right upper quadrant, which is the more complex one because it's the place which includes liver and biliary system. So liver diseases like infectious or non-infectious hepatitis, liver abscess, alcohol poisoning, hepatic congestion, and Budd-Chiari syndrome, which is a rare condition caused by obstruction in the hepatic veins, can be the source of pain in right upper quadrant. Biliary diseases like cholangitis, cholecystitis, gallstone, choledocholithiasis are biliary reason of pain in right upper quadrant. There are some other reasons which are actually the source of reverse pain. It means the pain originates from another place like lung and radiates to this point, like pneumonia or lung infection, pleurisy or pleurodynia. Pleurisy is an inflammation of the pleura or those layers surrounding the lung, and pleurodynia is a viral infection of the chest wall muscles like intercostal muscles, and sometimes pancreatitis can also be the reason for the pain in right upper quadrant. Now let's take a look on the culprits for epigastric pain. Epigastric region is the place which mainly contains stomach and esophagus. So a lot of disorders of these organs cause epigastric pain, like peptic ulcer disease, gastroesophageal reflux disease, gastritis, pancreatitis, and some other reasons like pericarditis, myocardial infarction, AAA or abdominal aortic aneurysm, gastric cancer, hiatal hernia, and esophagitis. Left upper quadrant is a place which the spleen lies down. So many spleen disorders manifest their pain in left upper quadrant, like splenic rupture, splenic infarct, splenic abscess. Some other reason related to other organs can radiate pain in these regions too, like gastritis, gastric ulcer, pancreatitis, and subdiaphragmatic abscess. Both flank usually manifest kidney disorders like nephrolithiasis or kidney stone, pyelonephritis or kidney infection, renal abscess, polycystic kidney disease, and urethral obstruction. Sometimes bowel obstruction and musculoskeletal cramps can cause pain in these regions too. Periumbilical pain is commonly from gastroenteritis, early stages of appendicitis, bowel obstruction, and in rare cases ruptured aortic aneurysm and mesenteric ischemia. Suprapubic pain can be from urinary tract infection or UTI, urinary retention, urethritis, dysmenorrhea or painful menstruation, pelvic inflammatory disease or PID, and ectopic pregnancy. Both right and left lower quadrant pain can be originated from inguinal hernia, testicular torsion, ovarian rupture, ectopic pregnancy, kidney stone, inflammatory bowel disease, and irritable bowel syndrome. There is some differences in right and lower quadrants that appendicitis is located in the right lower quadrant almost all the time, unless if there is unusual anatomic position of appendix. And diverticulitis is mainly in left lower quadrant and rarely happens in the right side. There are some types of disorder that cause generalized abdominal pain, means they are diffuse and the patient cannot localize the pain well. The common diseases in these types are gastroenteritis, diabetic ketoacidosis, inflammatory bowel disease that is divided into two separate disorders, Crohn's disease and ulcerative colitis, spontaneous bacterial peritonitis, and infectious colitis. As you see, evaluating the abdominal pain is not a straightforward process. We need to look at a symptom in different aspects like we have discussed about. We know that we should ask about age, location of the pain or referred pain, characteristic of the pain, duration of the pain, and associated symptoms. Beside all of this, we probably need more evaluation by performing proclinic tests to make the final diagnosis. In the next videos, we will discuss most common and most important diseases which cause abdominal pain in detail, and we will explain how to approach them step by step. If you have found this type of videos useful, subscribe to our channel and press the like button so you'll be notified about the upcoming videos.